Hi friends, welcome to our YouTube channel, one and only pharmacy. So friends, in this video we are discuss about MCQs on anti-diabetic agents or anti-diabetic drugs. Subject medicinal chemistry second, class B pharmacy third year, semester fifth. So friends, I request you to all please watch this video till the end. Let's start one by one questions. Question number first, insulin released from the cells means which cells produce the insulins. Option first alpha cells, option second beta cells, option C delta cells, or option D none. The correct answer is option number B, beta cells. Insulin released from the cells of beta cells. Question number second, which of the following is the definition for diabetes first or diabetes 1? Option first, the immune system destroys beta cells and no more insulin is being produced. Option B, the body becomes resistant to insulin. Option C, insulin is produced but not efficiently used. Option D, receptors for insulin are destroyed. The correct answer is option number A. The immune system destroys beta cells. The immune system destroys beta cells and no more insulin is being produced. These are the definition of diabetes first. Question number third. Which one of the following will be characteristic of diabetes type 2? Option first, the body becomes resistant to insulin. Option B, immune cell destroys beta cells. Option C, immune cell destroys kidney. Option D, increase blood sugar level. Option B is not possible because immune cells destroy beta cells. These are the definition of diabetes first. The correct answer is option number A. The body becomes resistant to insulin means its type of generally genetically occurs. Means the body becomes resistant to insulin is the characteristics of diabetes type 2. Question number 4. What do you mean by polydipsia? What do you mean by polydipsia? Option first, thirst from dehydration. Option B, osmotic diuretics like activity being a hyperglycemic agents. Option C, hunger. Option D, weight loss. The correct answer is option A, thirst from dehydration means polydipsia means thirst from dehydration. Option B is the definition of polyuria, osmotic diuretic like activity being a hyperglycemic. That means correct answer is option number first. Polydipsia means thirst from dehydration. Question number fifth. What do you mean by polyuria? Option A, thirst from dehydration. Option B, osmotic diuretics like activity being a hyperglycemic. Option C, hunger. And option D, weight loss. Option first is the definition of polydipsia, thirst from dehydration. The correct answer is option B, osmotic diuretics like activity being a hyperglycemic. That means polyuria means osmotic diuretics like activity being a hyperglycemic. Question number 6. What do you mean by polyphagia? Option A, thirst from dehydration. Option B, osmotic diuretics like activity being a hyperglycemic. Option C, hunger. Option D, weight loss. Correct answer is option C, hunger. Polyphagia means hunger. Thirst from dehydration means polydipsia. Osmotic diuretics like activity being a hyperglycemic means polyuria. And the correct answer is option C, polyphagia means hunger. Question 7. Most common complication in insulin therapy. Option A, lipotrophy. Option B, hypotension. Option C, hypoglycemia. And option C, gallstone. The correct answer is option C, hypoglycemia. Hypoglycemia means there is the decreased sugar level. Most common complication in insulin therapy is a hypoglycemia. Option C. Question number 8. Which of the following is not a natural phenomenon being a diabetic patient? Is not a natural phenomenon. Option A, increased urination. Option B, thirst from dehydration. Option C, less crave for food. And option D, weight loss. The option A, B and D are all the natural phenomenon of diabetic patient, but option C is not a natural phenomenon being a diabetes patient. That means less crave for food. The correct answer is option C. Less crave for food is not the natural phenomenon being a diabetes patient. Question number 9. What is the first line drug for patients with type 2 diabetes and obesity? Option first, acarbose. Option B, metformin. Option C, sulfonylureas. And option D, insulin. Correct answer is option number B, metformin. Metformin is the first line drug for patients with type 2 diabetes and obesity. Question number 10. What is gestational diabetes? What is gestational diabetes? Option A. The body becomes resistant to insulin. Option B. Immune cell destroys beta cells. Option C. Occurs in pregnant women. And option D. Increased blood sugar level. Correct answer is option number C. Occurs in a pregnant women are called a gestational diabetes. That means diabetes occur in pregnant women are called as a gestational diabetes. Remember these things. Question 11. Insulin deficiency is associated with option A. Reduced lipolysis. Option B. Increased ketogenesis. Option C. Reduced gluconeogenesis. And option D. Reduced proteolysis. Correct answer is option number B. Increased ketogenesis. Insulin deficiency is associated with increased ketogenesis. Question number 12. Which of the following is a drug for diabetes mellitus? Option A. Omeprazole. Option B. Sulfonylureas. Option C. Pantoprazole. And option D. Mannitol. Omeprazole, sulfonylureas, pantoprazole and mannitol. Mannitol is a diuretic drugs and option B is a sulfonylureas is the drug for diabetes mellitus. Question number 13. Which of the following is a drug for diabetes mellitus? Option A. Omeprazole. Option B. Acetanilide. Option C. Pantoprazole. Option D. Meglitinide. In previous question, we see omeprazole and pantoprazole are not the example of diabetes mellitus. Correct answer is option number D. Meglitinide. Meglitinide is a drug for diabetes mellitus. Question number 14. The risk factors for type 2 diabetes mellitus includes means what is the risk factors are observed in diabetes mellitus. Option A. Family history. Option B. Being overweight. Option C. High intake of dietary fat. And option D. All of the options listed are correct. Correct answer is all of option D. All of the options listed are correct because risk factor for diabetes mellitus includes family history, that means genetically occurs in diabetes mellitus. Being overweight means fatty person or obesity person, and high intake of dietary fat. Fat means the one and same is a overweight. Correct answer is option number D. All of the options listed are correct. So friends, thank you for watching this video. And friends, if you new on the channel, so please like, share and subscribe to our YouTube channel for pharmacy related daily update videos or MCQ for GPAT, NIPER, all pharmacy related exams. So friends, once again we see all MCQs in first. The risk factors for diabetes for type 2 diabetes mellitus include family history, being overweight, high intake of dietary fat. Meglitinide is a drug for diabetes mellitus. Sulfonylureas are the drug for diabetes mellitus. Insulin deficiency is associated with increased ketogenesis. Gestational diabetes means diabetes occurs in a pregnant woman. Metformin is the first line drug for patients with type 2 diabetes and obesity. Less crave for food is not a natural phenomenon being a diabetes patient. Most common complication in insulin therapy is hypoglycemia. Polyphagia means hunger. Polyuria means osmotic diuretic like activity being a hyperglycemic. Polydipsia means thirst from dehydration. The body becomes resistant to insulin are the characteristics of diabetes type 2, and or diabetes 1 means the immune system destroys beta cells and no more insulin is being produced. Insulin released from the beta cells. So friends, in today's video we are cover Some important MCQs on the basis of anti-diabetic agents or drugs. Subject medicinal chemistry, B pharmacy, third year, semester 5th. Thank you guys for watching this video till the end.